Joining us now is Ballad Health's Chief Infection Prevention Officer, Jamie Swift. Jamie, thanks so much. I know for you and the medical community, the big news is about the ability for families to get their children vaccinated against COVID-19. Who do you hope is considering that at this point?
We really want parents to start having that conversation. So, if they have questions, call their pediatrician, call their family medicine physician, talk to the health department, talk to Ballad. But we certainly want to have those conversations, get ready, and get those kids vaccinated just as quickly as we can.
Jamie, I think for many parents, the question is going to be something along the lines of this. Very few kids are getting the super sickest with COVID-19. That's a fact. So why would I want to do this? And I guess what I'm wondering is if you could speak to those parents who, once the recommendations are clear and once they've talked to their pediatricians, and they're trying to think, really, do I want to go through with this? And why would I, when my children aren't at the highest risk, why would I want to make them among the vaccinated?
Yeah, so there's really multiple avenues. So, numbers are low for severely affected children, but they're there. And we've had pediatric deaths, and we've had more pediatric deaths from COVID than we should have, and certainly than from other vaccine preventable diseases. And so that's number one, because it may be a small chance, but when it's your child who's in that chance, that's one too many. And we certainly want to prevent that severe illness, those hospitalizations, and those deaths. Secondly, there's a lot of information out there, but there's a lot we don't know. We don't really know what long haul COVID is going to look like in children. And so while we may not see severe effects right now, that's not to say that several years from now from this COVID infection that they couldn't be there. And so there's a lot that we have questions about. We know that long haulers exist, and it's certainly reasonable to think that'll happen in children as well. So we really want to take the preventive step, just like we do with all of our other vaccine preventable illnesses in children. So measles, mumps, rubella, all of those things that we get them vaccinated for, we just want to add this to that stockpile, prevent this illness, and avoid any child having to suffer through COVID and any long-term symptoms.
Let's talk about boosters. For those 18 and older, now all the manufacturers are cleared to offer a booster shot. I think for a lot of people, it's going to be one of those things like, when do I do that? Am I cleared to do it? So for you right now, who do you really hope is getting that booster right now?
So really those people who got the mRNA vaccines, if you had those 2 doses, then you're in those high-risk categories. So 18 and older with high-risk conditions, anybody 65 and older, anybody that has a high-risk exposure in their work setting, or if they're around the public a lot, they certainly can get that booster. We encourage those people to go get that booster. If you receive the J&J vaccine, they're encouraging anyone 18 and older who got that first J&J to go get a booster. The good news is you can mix and match now, and so if you got J&J and want to get a dose of mRNA, that's perfectly acceptable and reasonable to do at this point.
Finally, as we wrap up, it is flu shot season. I got mine this week. For people who are considering it, and we didn't talk a lot about flu last year at all. What's your wisdom to folks when it comes to getting that flu vaccine right now?
Last year we did really well at keeping the flu at bay, and we did that through our prevention measures that we had in place for COVID. We are hopeful that this year we can see the same low transmission of flu. It's actually very exciting from an infection prevention standpoint to realize that we could basically eliminate flu seasons by simply masking, social distancing, and doing all the things we were doing during flu season. Certainly vaccine is a key part of that. And so while I can hope that we have a mild season, we're not really sure what's going to happen. Flu seasons are completely unpredictable. So the best thing you can do right now is to go ahead and get that vaccine, get that protection, be ready if and when flu hits. That way we can minimize transmission and have another mild season.
Let's hope so. Jamie Swift with Ballad Health, thanks so much for your time tonight. We really appreciate it as always.